So today we're demonstrating a one-hole technique for temple and eyebrow augmentation, targeting age-related volume loss and eyelid ptosis. The entry point is lateral to the brow, allowing smooth access to both eyebrow and temple planes. Why are we filling this area? Well, let's discuss the biophysical changes in anatomy of the region. With age, we see fat pad atrophy in the temporal fossa, superficial temporal pad, retro-orbicularis oculi fat, the roof. This volume weakens the lateral brow support, exacerbating upper eyelid hooding. The frontalis muscle may overcompensate, pulling hard on the skin, leading to mechanical ptosis. Ligament laxity, especially of the orbital retaining ligament, also contributes to the descent. So just a bit about more eyelid ptosis. Eyelid ptosis can be epineurotic, levator dehiscence, but more often in aesthetics we see pseudotosis from upper volume loss. Several imaging studies show that anterior projection of the brow and temple correlating with hooding and heaviness. Well, why does this technique help? First of all, filling the lateral brow and temple restores the scaffold for soft tissues, lifting and relieving mechanical weight on the upper eyelid. It also improves continuity between forehead, temple, and orbit, providing a more youthful and rested look. And of course, using the one lateral entry point ensures minimal trauma and precise product placement. But as you are placing the product, the cannula, you will feel a lot of resistance. You have to gently go through, because a lot of fiber tissue here, ligaments and branches of the ligaments, and you kind of have to be very, very gentle. I kind of use a large bore cannula simply and to avoid skewering vessels with a smaller one. So always assess the lateral brow angle and temporal hollowing. These are early signs of facial aging. Use a soft moldable HA filler for hydration and structure without heaviness. So something that you would put in the lips, I realize is quite suitable for here because there's a lot of brands, I won't go through them all. And this subtle lift can delay or reduce the need for upper blepharoplasty in some patients. If you're watching this on YouTube, do leave a comment below on your experience with this procedure as a practitioner. We would really like to hear from you. Thank you very much.